In this video, we're looking at some exercises to help with sore, creaky or clicky knees. Lots of people suffer from knee problems, and these can be caused by either too little activity, where we do too much sitting, or by too much activity, so for example walking or running, especially where we increase the frequency quite quickly. A lot of these knee problems are actually caused by the kneecap. And this is quite an interesting bone because it's what's called a floating bone. So unlike most other bones in the body which form into joints, the kneecap floats in the tendon of your thigh muscles. So the thigh muscles and the fascia that surrounds them come down the front of your thigh, over your knee, and then form into a tendon that joins the bone just below your knee. And the kneecap sits in this tendon, and you can actually feel it moving if you put your hand over your kneecap and then bend and straighten your leg, and you will feel your kneecap glide over the knee joint. Now sometimes if your thigh muscles and fascia get too tight, then this can actually compress your kneecap onto the joint, and that's what starts to cause some of the problems like pain, clicking and creaking in the knee. So one way to help to release some of the restrictions and the tightness here is to use a myofascial ball or a trigger point ball in order to start to release some of these restrictions. So to work with this ball, I'm going to lie on my front and put the ball under my thigh. So it doesn't matter where I put the ball, as long as it is somewhere under my thigh and in a place that maybe feels a little bit tender or sore. So your thigh muscle actually wraps around your thigh. It's on the inside and the outside as well as the front. So you can work in different areas depending on where you feel things are tight and sore. So wherever you're working, you need to be there for at least 2 minutes to allow the fascia and the muscles to start to release and let go. And then you can move on to another place on your thigh. So some people working like this on the floor may be too uncomfortable, or it may be difficult for them to get on and off the floor, in which case you can do this on your bed instead. So this next stretch is for the fronts of your legs, and as with all things fascial, it's nice to keep things simple. So I'm just going to turn sideways on so you can see what I'm doing. So all you need to do for this stretch is to kneel like this. And by doing this, you're creating a stretch that goes from your quadriceps, through your knees, into your shins and your feet. And if you find that sitting like this is too uncomfortable because things are very tight, then you can use a pillow. And just put the pillow under your legs like this, and that will still give you a stretch without things being too uncomfortable for you. If, on the other hand, this is not enough of a stretch and you'd like a bit more, then all you have to do is lean back, and you'll feel the stretch deepen into your legs and your knees and down into your feet. So with all fascial stretches, you need to be in the stretch for at least 90 seconds to 2 minutes to allow time for the tissues to start to let go. As they loosen, you'll feel things starting to relax and release, and you may find that you can go back into a deeper stretch. So this is great for anybody who has tight quadriceps, any knee pain in the fronts of your knees, especially with your kneecaps, tight shins, so anything like shin splints, and tight feet. So the next exercise we're going to do is actually working on the sides of our hips. Now this may sound a bit strange for a knee exercise video, but actually the muscles and the fascia in this area directly impact on your knees. And this is because These tissues here are used to rotate your leg as you walk and run. To feel that, if you actually put your hand on the side of your hip as you rotate your leg, you will feel them working. Now sometimes through either too much use or too little use, these can get tight. And as they do, they start to pull your leg out. And so as it rotates out like this, it starts to affect how your kneecap tracks over your knee joint, and it pulls it out of alignment. So for a lot of people, they start to feel pain in the outside of their knee, sometimes called runner's knee, and this is actually being caused mainly by restrictions in the tissues up here around your hip. So to work on this area, first of all, just feel for the top of the bone, and then you want to be working about 1 or 2 centimetres just below that. And you can either use a myofascial ball like this, or you can use a smaller trigger point ball. So we're going to start by placing the ball on the floor, and then just lie or lean into the ball. So as you do this, it may feel quite tender initially, but as long as you're in one place for at least a couple of minutes, it will start to release and relax. And then you can gradually move around to different areas, allowing your body just to let go as you find each restricted area. Sometimes you'll get referred pain patterns, so sometimes when you're working here you'll actually feel it in your knee, and that means that you're on a trigger point. So again, you're just waiting for that to release and let go. If working on the floor is too uncomfortable, then you can do this on your bed, or if you prefer, you can actually work with the ball against a wall and just lean into it. So there's lots of different ways that you can do this exercise. So by doing these exercises regularly, you can start to release some of the tension in your legs and in your hips that are actually causing your knee problems. You can find lots more self-help myofascial videos like this in our Living Pain-Free online program, which is available via our website, where you'll also find our myofascial self-help release kits.